Hi, I'm Dr. Tam Cummings, and I'm a gerontologist specializing in dementia. What you are watching is part one of the Dementia Caregiver Education Series brought to you by the East Texas Alzheimer's Alliance. This is What is Dementia? There are 6 parts to this series. It is important that you watch them in the order in which they are numbered. That's because each session will build on the previous session's work. As we get started, understand that part of this may be difficult to hear because we're talking about someone that you love and care about. But just hang in there, because the more you understand the disease process, the easier this path and journey will be for you. To start with, let's discuss how stressed you are as a caregiver. The death rate for our dementia caregivers is 2 out of 10 will actually die before the person with dementia dies, and it's the direct result of the stress of care. In addition to the stress tips that you'll receive as part of this series, we also want you to learn how to do Greenstone's awesome icebreaker. This is something we use to help caregivers calm down within a minute. And calming down is something that is important because as you get more stressed, it puts more stress on your overall body. To use Greenstone's awesome icebreaker, this is something we do when you are just feeling completely overwhelmed. You feel stuck, you feel like your brain doesn't even work right anymore, and you can't even think about the next minute. Go get a piece of ice. Go stand at the sink and wrap the ice in one hand. Hold it tightly in your fist. Shut your eyes and breathe. Breathe in deeply, in and out through your nose, and take 10 deep breaths. At the 10th breath, drop the ice, open your eyes, and you'll find that you have calmed down. The reason for this is that the brain's primary function is to oversee and run the body. And so as you put a piece of ice in your hand, you really start to freak your brain out because it doesn't understand what's happening. Something in the hand is freezing, but it's also burning, it's wet, it's drippy, it's cold. Your brain has to shut down all those extra windows, all those worries and things that are bearing down on you. And in just a minute, your brain will be clear again and you'll be ready to go forward. One of the things I get asked by people is, what are the risk factors for dementia? And these are some of them. Some dementias occur just because of some weird, bizarre thing that happened, some strange toxic event or some sort of accident. Some people have had severe head injuries, and that can cause a dementia process to begin. For a lot of people, it's our cardiovascular system. We simply don't move as much as our previous generations did. It's been estimated we move 80% less than our grandparents, and our grandparents did not move as much as their grandparents. Human evolution is very slow, so this stopping of physical movement in the body takes a tremendous toll on us. Our cardiovascular system is critical, and it's important that you pay attention to that your entire life. There are people who have genetic risk for dementia, but the way that we can help them control that is by taking care of our body and our mind. The current diet that we're using is the Mediterranean diet because it's full of fish and vegetables that are used or roasted and cooked in olive oil. And it's just a different way of using food to nourish our body that's better for us. It means that we need to make sure we are doing physical movement and physical exercise, and that we are avoiding sugar. Our grandparents ate about 1.5 pounds of sugar each year. Today's teenager is taking in 154 pounds of processed sugar a year. Human evolution is very slow. So to control for these risk factors, pay attention to your diet and your exercise. We need to understand dementia, and we need you to understand dementia for a number of reasons. Remember, dementia is the umbrella term for a group of diseases. It's not the name of the disease itself. We need to know which dementia your loved one has because, quite frankly, it determines how much time they have left. It determines the genetic history for your children and grandchildren. It's no different than if a person had cancer. The type of dementia determines when care will be needed and how extensive the care will be. The type of dementia determines behaviors. The type of dementia tells us what stage the person is in. And the type of dementia helps us determine medication needs and uses. Now, as you start to wrap your mind around all this, the next question I usually get asked at this point is, well, what do I do to age well so that I don't get this? And understand dementias are diseases of aging, but they are not normal aging. So here are 5 things that you can do to age well. The number one exercise you can do is actually dance. Dance causes your brain to move large muscle mass in time to music. But I did not tell anybody to go to a dark, smoky bar. I just said dancing. And you can dance around your house, you can dance in the kitchen, but dancing is an incredible exercise. And ladies, if you think about it, Ginger Rogers did everything Fred Astaire did. She just did it backwards wearing high heels. Dance is the best mind exercise. After dance comes board games, card games, games that involve numbers and strategies, poker, dominoes, bridge, any kind of card game or board game. If you played a musical instruments are number three. Reading music and playing instruments lights up an area of the brain that only lights up for those events. If you learned your clarinet back in high school, break that bad boy out and fire it up again. Use that part of your brain. Puzzles are the fourth thing that your brain wants to do to really help it age well. And that can be crossword puzzles, putting a puzzle together, number puzzles, find a word puzzles, hidden object puzzles. There are all kinds of puzzle games you can do, both tactilely right in front of you and on your phone with games that you can get there. Last is reading. Continuing to read is very important for the brain, and it's important to challenge the brain with reading. As a dementia caregiver, we want you to read things that are pleasant and joyful and give you some relief and give you some humor. But also for your brain, stretch it and read some things that might be more challenging or more difficult. Things to help your brain tremendously include the Mediterranean diet. And sadly, I thought the Mediterranean diet meant that we would all move to Greece and live under palm trees and drink red wine. And it turns out that we're not really supposed to be drinking alcohol at all. We've gone from drink alcohol to drink 2 glasses of wine, 2 beers, or 2 alcoholic drinks to really you should only be having 1. And there is now a lot of research that says perhaps we shouldn't be having a drink at all. It's important for your brain that you do meditation. Meditation comes in many forms, but meditation actually causes your brain to grow thicker and richer root systems. It causes your brain to literally realign its neuron structure. It causes your brain to exercise itself. It causes your brain to cleanse itself of grief toxins or stress toxins. And it gives your brain an exercise that is unparalleled by any other. It does not work for your loved one because their brain is dying due to a disease process. But for you and I, it's important that we do meditation daily. And meditation may be prayer. Meditation can be done by using an adult coloring book because you're coloring such tiny spaces that the brain slows down, your respiration slows down, and you reach a meditative state. You can meditate by journaling, meditate by doing meditation walking. You can meditate by gardening. And you can begin to learn to use mindfulness. We know that as a person, if you step outside of your house, even for 10 seconds, your blood pressure will begin to lower just because you're outside. But when you're outside, pay close attention to the things around you. Don't just look at the group of flowers, look at the individual flower, look at its petals, look at its color, look at its veins. When you look at the tree, don't just look at the tree, notice the leaves, notice the twigs, notice the detail of the trees. It's called being mindful, being present in the moment, and it helps your brain to recover and repair itself from all the stress you're under. And if you're not under a tremendous amount of stress, it's great exercise for your brain. Watch comedy. When I get stressed, I go to Carol Burnett on YouTube and I laugh. If it's cat videos, do cat videos. If it's comedy on TV or movies, watch things that are fun because your brain needs to laugh. Your body needs to laugh. It's one of our great protections against stress. And when you're able to relax and laugh, it tells your body that you're safe right now, that it's okay, and it can let down its guards that are caused by you being stressed as a caregiver. And this is the meditation breath that we're going to use throughout this series. When you breathe in to the count of 4, hold it for 2, and breathe out to the count of 6, you begin to lower your respiration from 13 breaths per minute to 8. And 8 breaths per minute is considered meditative or prayer state. It's important for you to practice and do this daily because this helps your brain deal with the trauma of what you're going through with the stress, the guilt, and the grief of what you're going through as your loved one is in this disease. As we go through this series, there will be places where we will stop and breathe because we recognize that this is difficult information and that you are doing the best you can. And that's something to hold on to. Make sure that you start a meditation journal and a gratitude journal. Every day, write down something you're thankful for. And within 2 weeks, your own body will begin to respond to that. Inflammation in your joints will go down. Your stress levels will go down. As you every day take a minute to write down just a couple of things you're thankful for that day, it really will help you. Your journal, as you go through this journey with your loved one, will be tremendously powerful for you. It will help you realize all that you have done, all the care that you have given, and it will be a valued friend to you later on in the disease process. So to do the breathing, I want you to put your feet on the floor, put your hands in your lap with your palms up, and shut your eyes. I'm going to count for you. We're going to breathe into the count of 4, hold for 2, and breathe out to the count of 6. And we're going to do that 4 times. So feet on the floor, hands in the lap, eyes shut, deep breath in, 2, 3, 4, hold, hold, breathe out, 2, 3, 4, 5, 6. Deep breath in, 2, 3, 4, hold, hold, breathe out, 2, 3, 4, 5, 6. Deep breath in, 2, 3, 4, hold, hold, breathe out, 2, 3, 4, 5, 6. Last time, deep breath in, 2, 3, 4, hold, hold, breathe out, 2, 3, 4, 5, 6. Now, people get confused about dementia because we've not done a good job of explaining dementia. Dementia is not the name of the disease. Dementia is an umbrella term for a group of diseases that attack the brain. There are an estimated 128 identified dementias. Cancer is an umbrella term, and it actually helps you to understand dementia by comparing it to cancer. So cancer is an umbrella term. Cancer means cells of the body have gone astray and are attacking the body. There are 438 identified cancers, and those cancers have subsets, and you know this. If I said I had cancer, you would say, what cancer? If I said I had lung cancer, you would say, what lung cancer? It's the same thing with dementia. If you tell me your loved one has dementia, I ask which dementia. If you tell me your loved one has dementia of the Alzheimer's type, I ask which form of dementia of the Alzheimer's type. So the dementias have subsets as well. And the word dementia is not a good enough diagnosis. That's no different than telling you your loved one has cancer and giving you no more information. We can identify dementias before death, and we do that through the testing. Now, in cancer, the average family is a caregiver about 2 years. In dementia, the average family is a caregiver 10 or more years before you finally reach out for care. You are very stressed. It's not at all unusual that when I meet the family caregiver, you actually look worse than the person who has the terminal brain disease. And it's because of the length of time you've been doing care and the amount of care that you've been doing. In cancer, you understood there were subsets. When the doctor came out and said your loved one has cancer, you knew automatic questions to ask. You actually have about 30 questions that all of us know to ask if the word is cancer. You would have said, where will the testing take place? Where's the real testing going to take place? Because it's not with a 5-minute test. Where will we go for our doctors? Who will be our specialist? Who will help us through this journey? Will my loved one be qualified for chemotherapy or radiation? Is there another medication? Where will we go for treatment? How will you support our family? Where will my loved one go for final care? Those are the same questions you ask if the word is dementia, because the word dementia is not the answer. We need to know which dementia and which form of that dementia. When you find yourself stuck in what you're supposed to do next, trade the word dementia for the word cancer, and you will know the question you should ask. In cancer, there's always a miracle. Everybody listening knows somebody that was supposed to die several years ago of cancer, and they're still alive. In dementia, there is no miracle. These are terminal illnesses that destroy the brain. And because the brain runs the body eventually cannot function. The only thing that possibly looks like a miracle is that most of your loved ones will not live to stage 7 of the disease, which is the bedbound stage. Most of your loved ones will die in stage 5 or stage 6 of the disease as the result of a heart attack or stroke. And that's just because that's how human beings die. We die from heart attacks and strokes. When the cancer family's loved one dies, they have no measurable levels of guilt. And when we ask them why, they say, well, we did everything the doctors told us to do. When your loved one dies, you tend to have very large, huge levels of guilt. And the number one answer that you say to us is, I just didn't do enough. And I know you've already done at least 10 years of care. And I know that you've put your own health and your own life at risk. So it's important that we talk and deal with the grief and the guilt that you feel as a dementia family caregiver, because it's a normal thing for you to experience. These are the 9 most common forms of dementia that we're going to learn about during this series. These dementias account for approximately 98% of all the dementias. The remaining 119 dementias, some of them strike children, so we don't really see them. Some of them are so rare, there's only a few hundred cases worldwide. Some of them can only occur because of some odd poisoning or exposure to something toxic. Some of them are just caused by extremely rare things. These are the main ones that we deal with. And the way that you use this is you take away the dementias you know your loved one cannot have. And what that leaves you with is some real questions to go back to the physician with. So a way to use this is, real quickly, we'll just use my mother as an example. My mother is 82 years old and she never played football. So I can take off number 9, which is chronic traumatic encephalopathy. That's commonly called football dementia. My mother doesn't have Huntington's dementia. That's a dementia that is inherited from one of the parents, and the child either has it or they're a carrier for it. And people with Huntington's don't survive past their 30s, 40s, or 50s. Usually that's a very early dementia. And so my mother doesn't have that. It's not in my family, and my mother's simply too old. Wernicke-Korsakoff is alcohol dementia. My mother's never had a drink in her life, so she doesn't have alcohol dementia. My mother doesn't have Parkinson's disease, so she could not have developed Parkinson's disease dementia. Frontal temporal dementias are dementias that strike people who are in their 20s, their 30s, their 40s, their 50s. Death occurs within a few years of the symptoms beginning. At 82, my mother is simply much too old to have frontal temporal dementia. Lewy bodies dementias have some very unique features to them, some unique hallucination behavior. 4 common hallucinations that might be seen in a person with Lewy bodies is they see children, children playing, children doing things. They see bugs, spiders, rats, and snakes crawling on them and biting them. They see bad people coming to get them or to kill them or to hurt them. And they see their spousal caregiver or their family caregiver or their caregiver having sex with other people. And that obviously is very upsetting. People with Lewy body kick and punch in their sleep at night so violently that they can throw themselves out of bed or they can hurt their partner and push them out of bed. My mother doesn't have any of those features, so we can eliminate Lewy bodies. My mother does have high blood pressure, high cholesterol. She has some other health issues, so that would certainly make me want to ask the doctor about vascular dementia. Because of my mother's age, she's in her 80s, I would be talking to the doctor about late onset Alzheimer's, because that's the dementia for people in their 80s and their 90s. That's an Alzheimer's dementia. And then there's a possibility always that my mother has a combination of both Alzheimer's and vascular, and that would be mixed dementia. So by removing the dementias she cannot possibly have, I'm now able to go back to the doctor and ask some questions about those first 3 dementias on your slide. I hope that makes sense to everybody. You remove what it cannot be, and what you're left with is what it must be. Now, people with dementia don't look sick. And that's one of the things that's so frustrating for families, because humans think that if you're sick, you look sick. And in most illnesses you do, but in dementia, people don't look sick until they've lost almost a pound of brain tissue. And it's only then that you can see the wasting on the face, that you can see the changes in the body. And because of that, families can be fooled. You can think because your loved one's having a good day and because their physical self still looks normal, that the disease isn't really impacting them, but it is. It's just that you won't see the physical change to the body until stage 6 of the disease. People with dementia have great social skills, and social skills are some of our earliest learned memories. And so if I start out the conversation with, "Hi, how are you?" your loved one is instantly going to respond, "I'm fine, how are you?" And if I say, "Well, how is your family?" your loved one says, "They're fine, how is yours?" This isn't a sign of cognition. This is a sign of an old memory that you and I have said thousands and thousands of times. But people who don't understand dementia, people who are not specialists in dementia, think that they're witnessing cognition, and the social skill doesn't mean that. People with dementia also have something called a nosognosia. They're not aware that they have dementia. They're not aware that they're doing anything odd. They don't understand why you keep trying to help them, why you keep correcting them, why you're arguing with them. They don't look sick. And so to families, it looks like, well, they're doing it on purpose. And I can promise you, that they're not. Words that you need to lose from your vocabulary. Your loved one is not pretending. Pretending takes a 3-pound brain. Your loved one doesn't have a 3-pound brain. You wouldn't be watching this series if they did. Faking it takes a 3-pound brain. Pretending, lying, all of those things take a 3-pound brain. Your loved one doesn't have that. They're simply responding to whatever situation they're put in. And most of the times, especially as the disease progresses, they respond with that social skill, that social conversation, and other family members, medical professionals, other professionals, neighbors, family, friends at church and synagogue think the person is doing this on purpose, and they're not. You're simply witnessing the old memory of social skills. Now, the names of dementia are giving you information. Some of the dementias are named after the doctor: Alzheimer's, Pick's, Lewy, Parkinson's, Huntington, Creutzfeldt, Jakob, Newman, Barr, Wernicke, Korsakoff. All of these are the names of the physicians that found that particular dementia. Some dementias are named for the area of the brain they're attacking. Frontal temporal dementias are telling you the disease is in the frontal lobes and the temporal lobes. Some of the dementias, the name is telling you what caused the dementia. Vascular dementia is telling you something in the cardiovascular system didn't work correctly. In some dementias, the name is telling you the outcome: primary progressive aphasia. The course of this dementia's focus is the person's inability to use and understand language and speech to the point that they become mute. So the name of the dementia is giving you information, and that gives you a source to go to on the internet to find even more information. This is Alice Alzheimer, and the woman is Augusta Dieter. Augusta Dieter was taken to the hospital by her family when she was 54 because she seemed to have fits of rage and jealousy. She at times didn't seem to recognize her husband or her children. She didn't seem to realize she was living in the same home she had grown up in. She didn't recognize the area or space around her, and she was getting lost. So the family took her to the hospital, and Dr. Alzheimer did her intake. And the actual notes on Augusta Dieter were found several years ago, and they very much look like an intake we would do today. He tested her long-term memory and her short-term memory, and he could tell that her short-term memory was heavily damaged. She didn't know, she couldn't identify the food she was eating. She couldn't learn the new names of the people around her, but she knew that the grass was green, the sky was blue. She could identify a pencil. Dr. Alzheimer continued to follow her, and he ordered an increased diet for her, increased exercise, a daily spa and bath routine. And in spite of everything they did, she continued to decline. When people look at this picture, this is the only photo taken of her. She was 55 in this picture. And when people look at it, they're shocked because she looks much more like somebody who would be in their late 70s or their 80s. Augusta Dieter died about 2 years after this picture. When she died, Dr. Alzheimer was called back to do her autopsy. He wrote 4 things that he found in her brain and presented that paper at a medical conference. The 4 things he found were that her brain had shrunk dramatically in size. Instead of weighing 3 pounds, it weighed 1 pound. The brain was full of cerebral spinal fluid where there should have been actual brain tissue and structure. The brain cells that were left were heavily damaged with what are called neurofibrillary tangles, and there was actual bone plaque growing in the brain tissue. The paper was presented at a conference. The paper was then included in a medical textbook, and the chapter was called Alzheimer's disease. This is who that name comes from, and this is the woman that the paper was written about. These are some of the physicians that the other dementias are named for, and it's just part of the history of the disease. Now, as a family member, there are 5 questions that you need to ask. The first question is, which dementia does my loved one have? And it's important that we know that, because that's just going to help you as you understand the disease process. The second one is, do you understand the brain is dying and how the brain is dying? The brain is dying because of actual stroke activity where the brain area didn't get oxygen, so those cells die, or the brain is dying through the process of proteins failing and each neuron is dying. And then there's also plaque growing in the brain where another protein that lives in the fluid of the brain begins to break apart and form bone plaque. The third question is, do you understand that your loved one's going to fall? So have they started falling yet? Your loved one's falls are not related to them not trying hard enough. They're related to brain damage. Everything your loved one is doing is directly related back to brain damage. People with dementia eventually can't move their bodies. They can't walk. They can't even turn themselves in bed. They're not able to chew and swallow food correctly. They can't move their arms and legs correctly. That is not a person not trying. That is a person who has massive brain damage. In the course of most dementias, the motor cortex is destroyed, the premotor cortex is destroyed, the limbic system and the basal ganglia are destroyed. And you need all of those systems functioning to be able to walk correctly. Has your loved one had a urinary tract infection yet? Urinary tract infections are part of the disease of dementia, and they occur because of a damaged brain not able to protect the body from infection. The parietal lobe takes so much damage in the course of dementias that it's not able to raise the body's core temperature. It's not able to tell white blood cells to fight infection. It's not able to tell T cells to fight infection. Urinary tract infections are not a sign of poor care. They're a sign of the advancement of the disease. So these are the 9 most common dementias. And in your handouts and in chapter 4 of this series, we're going to cover these in detail. We'll go through each one of them and explain what they are and what the different domains are, and then you'll have a handout that will match this. You have to remember, as your loved one's brain starts dying, the brain runs the body. So the body eventually works less and less efficiently. The question that I hear from families frequently is, yeah, but he's so healthy. He's just so healthy. His body looks so good. He's not really healthy. It's just the disease hasn't caught the body yet. It will do that in stage 6 of the disease. Your loved one will lose 1/3 to 1/2 of their body weight should they live to stage 7 of the disease. So the brain runs the body. Eventually it will catch it. It's just that you won't see that kind of damage to your loved one until stage 6 of the disease. As neurons begin to starve because tau protein doesn't fold correctly, they starve to death, they die, they're removed from the body and waste. Strokes happen, they block a blood vessel based on whether it's a large stroke in a big blood vessel or a tiny stroke in a tiny blood vessel, determines whether or not the stroke is even observable to others, or if the person who had the stroke is even aware of it. Your loved one's going to fall, and some of the falls are very, very unique. The most common fall, and it begins with Alzheimer's because they're our biggest group, is that they actually fall back into their chair, so you and I don't even notice them. Later on, they will begin to fall more the way people with vascular dementia are likely to fall, which is when these people stand, they don't fall back into the chair, their blood pressure doesn't acclimate, and so Alzheimer's people, vascular people, and anybody with dementia will eventually begin to fall forward out of their chairs, landing on their faces, their knees, and their elbows. Lewy body and Parkinson's dementias are considered first cousins of one another, and they fall very uniquely. Lewy body and Parkinson's disease dementia people may suddenly stiffen and fall completely forward like a plank landing on their face, or stiffen and fall backwards, landing and hitting the back of their head. These are unique falls to them. They're not related to blood pressure. They are thought to be related to damage in the basal ganglia area for both of these dementias, and they're also related to a sudden onset of unconsciousness and fainting that's not related to blood pressure. So it's not well understood how these falls occur. They're just much different. Frontal temporal dementias, the behavioral and sexual dementias, and the communication dementias. In late stage 5, these people begin to bend forward at the waist, and they are very out of balance. It's not unusual that they may have dozens of falls a day with head strikes, and they do not keep helmets on. Wernicke-Korsakoff is alcohol dementia. How much this person abused alcohol will depend on how their falls are. Huntington's dementia is one of the forms of Huntington's is called Huntington's chorea. Chorea is spelled with a CH, not a K like the country. Chorea means the limbs are jerking. So this person falls in any direction. Chronic traumatic encephalopathy is commonly called football dementia. Based on the amount of damage to the brain, this person could also fall in any direction. When you think about falls, you've also got to prepare yourself for stage 6 of the disease, and your staging tools are included in your handouts. In stage 6 of the disease is when we anticipate that your loved one will suffer a spiral fracture of their hip. The hip doesn't fracture because the person fell and hit the floor. The hip fractures because the person stands and turns. So your loved one stands and turns at the table and the hip breaks. They stand and turn from a toilet and the hip breaks. They stand out of their bed and turn and the hip breaks. Because of damage in the parietal lobe, your loved one may walk around on that broken hip for a few hours or even a few days before the hip fractures enough to cause the fall. The fall didn't occur because someone wasn't doing care. The fall occurred because of brain damage. When your loved one breaks their hip in stage 6, and it is a spiral fracture of the hip, it means that the end of life is coming. It means that the brain is now too damaged to maintain the skeletal structure. It is not poor care. It is the disease process that is causing this to happen. One of the most common medical myths is that diapers cause urinary tract infections, and that's simply not true. Adult incontinence products are used on people with dementia because typically in stage 5, your loved one will lose control of their bladder and become incontinent of bladder. In stage 6, they will become incontinent of bowel. Because of the damage in their brain, urinary tract infections will become a frequent thing in your loved one's care. And at the end of life, they will come one right after the other. And that's not a sign of poor care. It's a sign of extensive brain damage. This is the mnemonic that we use when we think about treating urinary tract infections. And you'll notice that the mnemonic name is diapers, and diapers is misspelled, but this is a nurse's mnemonic, so I don't know, I can't help you. This is from Grand Rounds of 1984. This is considered the gold standard. What this box means is delirium causes UTIs, and UTIs cause delirium. Urinary tract infections are a symptom, especially of late stage dementia. Women are at a higher risk always for urinary tract infections because we naturally lose fluid through thinning vaginal walls as we age. We give people medication that dries up fluid in their body, things for their heart disease. We give people medications for depression, and people with dementia have depression, and people with dementia can be so depressed that they will not take in fluid because they realize they'll have to ask for help to go to the bathroom. So we have to pay a lot of attention to that. We give people medications that make them pee. And even people with dementia figure out we're giving them a pill that's making them pee 30 times a day, and they're not going to ask for help. So they'll simply stop drinking. People who have restricted mobility and people with histories of stool constipation or stool impaction are at a much higher risk. And all of these things are normal things that occur in people with dementia. So urinary tract infections are not a sign of poor care. They are a sign of the advancement of the disease process. The 5th question for every family is, how guilty do you feel? How many of you listening right now feel guilty for listening? How many of you listening right now feel guilty for thinking about the care of your loved one? How many of you feel guilty because you've reached the end of your rope? How many of you made a promise to someone that you would never put them somewhere? We knew before COVID that 2 out of 10 family caregivers of people with dementia die before the person with dementia dies as the direct result of the stress of care. Our concern is that with COVID in place, that number may have gone up to 3 out of 10 family caregivers die before the person with dementia. And it's because of the amount of care you're doing. It's because of the guilt of care that you're doing. Some of you have made promises to a person that you would never place them in a nursing home. And when you made that promise, I have no doubt that you never in your life imagined there was a disease like dementia. Dementia people require 24-hour medical care. It's not a question of you're not a good person. It's a question of these people have significant brain damage. They need to be around trained medical professionals. They need to be where the doctor comes to them, where nurses are there 24 hours a day, and they are qualified for that care in late stage 4 of the disease. Most people in our country aren't diagnosed until stage 5, so the chances are your person is more than qualified to be in memory care, and they will get better care there, and you can go back to being the person who oversees care. So ask yourself this question. It's time to move your loved one to a community. Do you plan to come back? Are you going to come back to do the care plans? Are you going to come back and visit? Will you send cards and letters? Will your children and grandchildren continue to treat this person with a place of honor in your family? Are you going to be there on birthdays and holidays? If you can say yes to those things, then you need to let the guilt go. You're doing the best you can with a disease process we didn't even realize existed, truly existed, until the 1970s. You're doing the best you can, but your loved one requires medical care, and we want you to survive the disease. Help your family let their guilt go. Help them recognize that your person's place is now in care, and your place is back to overseeing their care. Let's all just take a deep breath in, feet on the floor, hands in your lap. One deep breath in, 2, 3, 4, hold, hold, breathe out, 2, 3, 4, 5, 6. This is the conclusion of what is dementia. The next part in the series is the lobes of the brain. We hope you'll join us.